Welcome back. Treating pain can be a balancing act, and local health professionals do their best to weigh patient comfort with those potential addictive qualities of opioids. And here to discuss the process this morning from Gunderson Health System, Dr. Stephanie Neuman. Dr. Neuman, thanks for being here this morning.
Good morning. Thanks for having me.
Can you tell us a bit about when and why opioids are prescribed?
So that's a great question. So we know opioid medications work really well in the short term. So they have a nice role with acute pain. So a patient breaks a bone, they have surgery, they need pain relief. They can be very effective in those situations.
So
what we know,
yeah, go ahead.
Oh, sorry. What we know though in the long term, the evidence shows that they tend to become less effective over time. And that's mainly because the body develops tolerance to them. Because of also the issues with abuse and misuse that we've seen, we have tried to steer away from those as a first-line treatment.
So what action can patients take with regard to this when they're meeting with their healthcare professional?
A great question. So I think having that discussion about when opioids need to be used is really important. Fortunately, we have a lot of other non-opioid options to treat pain, so we tend to rely on those options first.
Can you talk about some of those options and how they're different?
Sure. So some of the first things that we often think about are some of those conservative or complementary things like seeing the physical therapist, occupational therapists, chiropractors, acupuncturists, massage therapists using heat and cold, essential oils, things like that. If patients don't do well with those things, then we do think about medication options, and there's lots of other non-opioid medication options out there. I'm an interventional pain physician as well, and so I'm trained to do different injections and procedures to help with patients' pain. So my colleagues and I, we use live x-ray machines and ultrasound machines to do injections and procedures in different areas of the body as well that can help with pain.
And do you find that patients are at all hesitant to go with some of the alternatives to opioids? I mean, you think when you got pain, maybe just take a pill. It sounds like it's easy, but is this kind of the way it's going?
Absolutely. You know, it's a very easy thing to first kind of move to. And if patients have had opioids in the past and they've found that they've been effective, often that's kind of what they ask for and want again. But again, what we found that over the long term, if these are used on a chronic basis, they just tend to become less effective and can lead to other problems like addiction and misuse.
Yeah, Dr. Neuman, we're running out of time this morning, but thank you for clarifying some of the different alternative medicines we can take before starting those opioids, those potentially addictive drugs. Dr. Neuman, thanks for being here.